Before we begin our cardio burst, we'll take a couple of postural stretches. Come over to the wall, bring your arms to a high V. Let's start with your dominant arm in a high V, twisting away from it. Soft micro bend in the elbow, lift at the chin, soft bend in the knees. Inhale 1, breathe. Exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3. Turn and face the wall. Switch the arm, V, micro bend in the elbow, twisting away from it. Inhale 1, breathe. Exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3. Turn and face the wall. W, twisting away. So a cactus arm, leaning forward, twisting away. Inhale 1, breathe. Exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3. Turning to face the wall. Give me that cactus arm on the other side. Twisting away, leaning forward if that helps you find those tight muscles. Inhale 1, breathe. Exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3. Turn and face me, taking your arms overhead. Grab your right wrist. Actually, let's cross our right leg behind our left, bend our knees, push our hips forward. Grab your right wrist with your left hand and side bend to the left. Hold it here. Inhale 1, push the pelvis forward. Exhale 1, bend the knees. Inhale 2, pull your abs in. Exhale 2. Inhale 3, exhale 3, and bring yourself back up to center. One more time on that side. Side bending, bend the knees, push the hips forward. Arch your upper back, pull the core in. Take your gaze up higher than eye level. Plug your shoulders down. Okay, let's take it to the other side. So switch the cross of the legs. So now it'll be left behind right, bending the knees, pushing the hips forward. Right hand grabs the left wrist, side bending to your right, following me, arching the upper back. Don't lean forward. Push the hips forward and arch your upper back, opening up the side body and the hip flexors if you've been seated for work or travel. Breathing into that. Inhale, 2, 3, 4, and exhale, 2, 3, 4. One more. Inhale, 2, 3, 4, and exhale, 2, 3, 4. Bringing it back up to center. And let's side bend one more time, holding. Inhale 1, breathe. Exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3, and back up on your inhale. Okay, let's learn all exercises, only 50% effort, getting comfortable with the movement before we begin our all-out cardio bursting. We'll need our 3-pound weight, our 5-pound weight, and our red loop band. Bringing the red loop band around your ankles, it looks like this. This is not good for my posture, but excellent for yours. So you're going to keep the red loop band around your ankles. Looks like this. Go ahead and put it on. I'm taking it off, but you're putting it on and keeping it on. Okay, the 3-pound weight. Hold it in your dominant hand. I'm left-handed, so I'm holding the 3-pound weight in my dominant hand and the 5-pound weight in your non-dominant hand. Bring your arms up to cactus. If at any time you feel the front of the shoulders paining, you need to lose this weight. You need to get rid of it, or you can go down to just holding the 3-pound weight in your non-dominant hand. So you can switch the weight into the non-dominant hand and lose the 5-pound if it is too much. But for now, we have the 5-pound in our non-dominant hand and our 3 and our dominant. Arms in cactus. We're going to be doing a gallop. You have the red loop band on your ankles. So it's a gallop step, chasse step. And then we'll do 4 oblique crunches, bringing the thigh to knee flexion, flexing the toes, feeling the hip flexors and quads working, side bending towards it like we just did in our 2-for-1 stretch 3 times, and then we'll gallop back to the other side and we'll bend. 2, 3. Gallop or chasse and make the accent up. So you're getting up, you're using the front of the thighs and the hip flexors and bending, working the external obliques, stretching out the lats, feeling the strength of the upper back. So imagine my hands hovering behind your shoulder blades. Puff the back ribs towards my hands, engaging your back instead of your chest or the front of the shoulders. This is our first exercise. You can set the weight down. Keep the red loop band. Again, that red loop band, keep it around your ankles. I'll put it on just so you remember. If for some reason you have taken it off, please keep it on for this exercise. This isn't good for me, but this is excellent for you. Transverse plane, where 90% of injuries occur, imperative for sports performance and injury prevention. Let's start marching. You have the band on, so you're going to dorsiflex your feet as you march. Do not lift the thigh so high that you round your back. So keep lifting the thigh only as high as you can maintain a neutral pelvis. So you got to stick your butt back. You got to bend your supporting knee. We're going to stop our marching and we're going to go low to high, alternating punches for 8, 7, 6, 5, bending the knees, twisting from our torso, not moving our legs or pelvis, isometrically holding the lower body and just isolating the upper body. And then we begin our arm swings as we march, turning back to face me, 8 marches, and then in place, soft knees, low to high punches for 8, 7, 6, 5, 4, 3, 2, 1. And we march again. Swing the arms, proud chest. Imagine my hands hovering from your shoulder blades. Puff the back ribs towards them. Tip your tailbone back. Soft bend in the knees, alternating low to high punches. 8, 7, 6, 5, 4, 3, 2, 1. Final exercise. I'd like you to grab your blue Theraband, and you're going to take it behind your back, wrapping around the ends, palms facing forward. I want the knees soft, feet dorsiflexed. You'll travel forward with heel digs. So you're putting your heel on the floor and flexing the toes up towards your face. Alternating those heel digs, you add a little bit of a hop component. Now, if that bothers your knees or back, you can keep it down into the ground, still dorsiflexing the toes towards the face, but not hopping it, okay? So hop it if you have no knee or back issues and you can maintain that neutral pelvis. Just walk it if you have any knee or back issues. At the top and at the bottom, we'll be doing alternating lateral flexion. You're going to pull out on that band that's behind your back as you go to the side. Pull down and out, alternating sides for 8, 7, 6, 5, 4, 3, 2, 1. And then we take it back. We do our heel digs back for 8, 7, 6, 5, 4, 3, 2, 1. And then in place, soft bend in the knees, neutral pelvis, focus up with the eyes higher than eye level, alternating lateral flexion for 8, 7, 6, 5, 4, 3, 2, 1. Grab a sip of water. I'm going to remind you of that first exercise. You're putting on the red loop band, remember, around your ankles. I am not, but you are. You're grabbing the 3 and 5 pound weight if that didn't bother the front of the shoulder, holding the 3 in your dominant hand and the 5 in the non-dominant hand. Again, if this is too much, just hold the 3 pound in your non-dominant hand. Otherwise, looks like this with the weights. You have the red band around your ankles. We do our chasse or gallop, and then we do our 3 oblique crunches. Let's actually make it 4. 4 crunches and a gallop. 4 oblique crunches and a gallop. Side knee flexion, foot dorsiflexed, side bending, lean your head back, take your focus of your eyes up higher than eye level, counting you in. 5, 4, 3, 2, 1. Here we go. 100% effort, full minute on the clock. First cardio burst in the frontal plane here. You're giving me everything you got. Remembering that you can always step this. You don't have to add that hop or gallop. You can step together, step if you have any knee or back issues. So you can step together, step. No need to hop or gallop it if it bothers you. But if it doesn't bother the back or the knees, you can add an accent up on that chasse and gallop. And those 4 oblique crunches, make sure the upper back is puffing into imaginary hands hovering above your shoulder blades. Your shoulders are plugged down. Your chin is lifted. Your gaze is soft. Collarbone wide, belly firm. Tip that pelvis back. Initiate from the lift of the lower pelvic floor. Hang in there. You're doing great. Only 15 seconds to go. How hard can you go? If the front of the shoulders are bothering you, you need to switch the weight out. Be honest with yourself. Take care of your body. Counting you down. 5, 4, 3, 2, 1. 30-second break. 30 seconds here. Goes by really quick. I'm going to count you. I'll let you know when you have 10 seconds. We're repeating this exercise. Same exercise. You have the red loop band around your ankles to engage more hip flexors and quadriceps. I do not, because I have lordosis posture, and that is not great for me. Okay, I'm going to count you in. You got 10 seconds. Counting you in 5, 4, 3. Repeating this exercise, 2, and 1. Here we go. 100% effort. Frontal plane, cactus arms, oblique crunches, accent up on that chasse or gallop or step together step, and just keep it with a micro bend in the knees. So don't really deeply bend your knees and go into a squat when you step together step. I want you more in the front of the thighs, hip flexors. So I want the knees just soft if you're doing the step together step transition from side to side. 4 oblique crunches. Make sure you're breathing. You're doing great. More than halfway there. 25 seconds on the clock. How hard can you go? How much can you push yourself? This is for your heart health. Keep breathing. Hear your breath. Chin up. Gaze higher than eye level. Plug those shoulders down. Counting you down. 5, 4, 3, 2, 1. Set those weights down. We won't need them anymore. You get a sip of water. You've got your 30-second break. While you're taking your break, I'm going to demo the transverse plane. Remember, your red band is around your ankles. You'll wear the red band. I will not because it's bad for my posture. I'm going to march for 8, 7, 6, turning from 12 o'clock to 3 o'clock. Then at 3 o'clock, I'll bend my knees softly, and I will do 8 alternating punches from low to high. I'll come back into those swings, neutralizing my pelvis, only lifting my thighs as high as I can maintain a neutral pelvis. Okay, make sure the red band is on your ankles. Setting up, counting you in. 5, 4, 3, 2, 1. Here we go. First full minute in the transverse plane. How hard can you go? How much can you push yourself? Use that breath. Hear your breath. Listen to your body. Are you lifting the thighs too high? Are you rounding your low back? We do not want you to round your low back. Not great for the back. Only lift the thigh as high as you can maintain a neutral pelvis by pulling your core in and tugging in and up on those muscles that stop your stream of pee. Make sure your back ribs are puffing into the imaginary hands hovering above your shoulder blades. Your chin is up. Your gaze is always higher than eye level. When you do those punches, that gaze can follow the wall in front of you or your target that you're seeing. Remember, they're cross punches. You're not moving your pelvis or knees when you're doing your punches. Isometrically hold the bottom half of your body and twist from your rib cage to get a nice abdominal workout with those punches. Hang in there. You're doing great. 5, 4, 3, 2. Take your 30-second break. 30 seconds here. We will repeat this exercise. Remember, you have the red loop band on your ankles. If this becomes too much and you're feeling strain, you can always go back to our green loop band in the Uniquely Fit kit. Again, you can always take it down to the green loop band. Make sure you're not sitting down. Grab a sip of water. Remember your 8 cups a day. And let me count you in. Here we go. 5, same exercise. 4, 3, 2, 1. Transverse plane. 8 marches with swinging arms to turn with a neutral pelvis, abs braced, foot dorsiflexed. 8 alternating punches, isolating, twisting from your rib cage, keeping your lower half of your body still, soft bend in the knees, neutral pelvis. Keep that going. How hard can you go? How much can you push yourself? Remember, if weight loss is a goal, always have water with you at meals. Every 10 bites of food, 10 sips of water. This is a great way to decrease your portions and to increase that water consumption so you're reaching the recommended amount, which is 8 cups a day. And that's not counting if you've had any caffeine or alcohol. You have to add an additional cup, and a cup is 8 ounces. All right, counting you down. Here we go. 5, 4, 3, 2, 1. 30-second break. While you're taking this break, let me demo our final exercise with the blue Theraband. You don't need to do it. You have your 8 heel digs. Remember, you can walk them with the dorsiflexion of the foot, reaching the toes towards the face, or hop them. And then at the top and bottom, we're going to do our 8 alternating lateral flexion, keeping our focus up, eyes higher than eye level, pulling down and out on that band, engaging our lats, engaging our external obliques, setting you up. Here we go. 5, 4, get ready. 3, 2, and 1. 100% effort. First burst in our sagittal plane. You're either walking those heel digs, really flexing your feet with a soft bend in the knees and sticking your butt back. So think duck butt or J-Lo butt. Pelvis is back. Abs are in. Shoulders are plugged. When you stick your butt back, do your front ribs push forward? Can you still have the butt back with the sternum and breastbone softening in? Chin lifted. And as I was mentioning about water consumption, if you're eating out, ask for water without ice. This way you can consume more. And every 10 bites of food, you have to have 10 full sips of water. You'll be amazed at how you will be able to cut down those portions, eat less, get to your goal weight in a much quicker fashion, and be able to maintain it. Learning to drink water as opposed to eat and stay hydrated is imperative. Counting you down. 5, 4, 3, 2, 1. Final 30-second break before our final burst in the sagittal plane. You've done wonderful work. We'll repeat this exercise. Remember, you can hop it if you have no knee or back issues. Walk it if you have knee or back issues. Plug the shoulders down. Think about those front ribs reaching through the body towards the back body. Pull the navel in. Lift up on the muscles that stop your stream of pee. Get set up. We got 10 seconds. Setting yourself up. Remember, the palms are forward. They're not facing, the palms are facing towards the butt as you pull out on that band. And the elbows are soft. Don't lock out in your elbows. Counting you in. 5, 4, 3, 2, 1. Here we go. 100% effort. Give it all you got. This is your final minute. And know that you are doing this for your stress management, for anxiety. This helps combat depression, and most importantly, for your heart health. So the National Heart Association recommends between 4 to 8 100% cardio bursts a week 3 times. So you're doing a 3-minute warm-up as we already did. Keep going, push yourself. And then between 4 to 8 bursts with somewhere between a minute to 30-second recoveries. You're getting that in now. Mark your calendar for 2 more bursts, because it's recommended you do 3 a week for your heart health. 10 seconds to go. How hard can you go? Push yourself. Alternating lateral flexion. Pull down and out. Puff the back ribs towards imaginary hands on your shoulder blades. Lift the chin. Keep the focus up higher than eye level. Counting you down. 5, 4, 3, 2, 1. Great job.